Cardiac arrest, I ran.
Didn't have the second health minister in a row.
I'm not sure he would have kept up with me if he ran, though. You guys all set?
Yes.
Okay. Well, thank you, everybody, for joining us today. I'd like to extend a welcome as well to Dr. Chris Luscombe of Killick Healthcare. Dr. Luscombe is joining us today virtually from Grand Falls-Windsor. We are very excited today to announce that we have reached an agreement with Killick on the family care team space for Grand Falls-Windsor. So the new family care team will be located at the Killick Centre on in the Lynken Building on Lynken Road. It can accommodate 21 staff. So the Health Authority are now looking to recruit staff for the new family care team at the Killick Centre. It will include 2 physicians, a nurse practitioner, a physiotherapist, an occupational therapist, a psychologist, as well as other health professionals. So this team will help ensure that people in the area are connected to primary health care. We have had tremendous success with our family care teams to date. We've added an additional 21,000 people who have been rostered to family care teams since March of this year, bringing the total now to individuals rostered to family care teams to 49,000 in the province. So any resident who is not connected to primary care can visit our Patient Connect website at patientconnect.nlchi.nl.ca or call 1-833-913-4679 to be rostered to a family care team. We've got 19 that have been announced. There are currently 14 family care teams that are either partially or fully operational in the province today. So the addition of the family care team at the Killick Centre will be a welcome addition to this. As we're able to staff up, this will become operational as well. There are plans for Gander and Lab West on the south coast as well, and we anticipate that even more people will be rostered in the coming weeks to our family care teams. I'd like to invite Dr. Luscombe now to make some remarks. Before I do, I will say that the incentive for physicians to join a family care team in Grand Falls-Windsor or at any of our family care teams for that matter is $150,000. For a nurse practitioner to join the family care team in Grand Falls-Windsor is $80,000. So certainly hoping that we will get some interest and some activity from nurse practitioners and physicians to join the family care team being established at Killick. Dr. Luscombe.
Thank you so much, Minister. Good morning, everyone. Killick Health Services in Grand Falls-Windsor has been supporting family physicians in central Newfoundland now for over 15 years. These family physicians have made considerable contributions to the healthcare of local residents, but now report they are seeking new models of care and support in order to continue their practices. Our organization has led many local innovations, including early adoption of electronic medical records, championing virtual care services, enhancing collaboration with specialists in obstetrics, gynecology, women's health, and psychiatry. Through the pandemic, Killick Health continued to innovate and partnered with Central Health at the time to provide care to unattached patients in the larger region of central Newfoundland through the Health Hub model. Today, we're very excited about this new partnership with Newfoundland Labrador Health Services. It will allow innovative development of a team-based primary care team in Grand Falls-Windsor in collaboration with local family doctors, as was envisioned in the Health Accord. This is a positive step forward in assisting local primary care capacity building and can increase support to family physicians working in community clinics. It is hoped that this will greatly improve local family physician recruitment and retention. Thank you, Minister. Back to you.
Thank you. We'll open it for questions now for either myself or Dr. Luscombe.
Question for Dr. Luscombe, assuming he can hear me through the microphones up here. Under the new funding model, you could set up your own collaborative clinic using blended capitation. Why go with the government sort of setup model rather than creating one? Because you already have sort of created that in a somewhat different context within the Killick system.
So currently, these are all going to be new models, how family medicine is going to be delivered in these communities. And each region, I think, is going to be different. What I feel is positive about this particular approach is that Killick has infrastructure in place, and we have 15 years of experience in delivering family care services. We've had multiple collaborations with the local health authority and partnerships to share resources and to collaborate. So it's really a situation where we have a bit of a built-up shop to be able to come in and set up a family care team. So I think that one of the strengths of this is that we have this history, we have this experience, and we have this infrastructure, so that we hear physicians say, "Listen, I just want to show up with my stethoscope." So I think the positive thing about this model is that many of the business headaches of operating a family practice clinic will be supported by individuals with considerable experience in running these types of practices.
If I could add to that as well, we are delighted with this agreement with Killick. They've been a very valuable partner in healthcare delivery in Grand Falls-Windsor. One of the things that makes the family care team attractive to health professionals is they are operating in a multidisciplinary team approach to providing health care. So I guess, Peter, to answer your question, the benefit of a family care team, especially for an area like Grand Falls-Windsor, and Dr. Luscombe is correct, family care teams will look different in different areas of the province. It's based on the need of the community that it's serving. But this multidisciplinary team-based approach, I believe, will be attractive for health practitioners.
Mr. Osborne, speaking of Grand Falls-Windsor, I spoke with a physician last week who is closing her practice in Grand Falls-Windsor at the end of December, and what it boils down to for her, she says, is frustration with a lack of movement on the evolution of family medicine. Can I just get your response to her concerns?
I do take some exception to that. We have, under Dr. Luscombe's tenure as the head of the NLMA, and he can speak to this as well, but whether it's the blended capitation model or a number of other areas where we have worked with the NLMA and worked closely on dealing with family medicine and other healthcare issues that physicians deal with. You can look to any province in Canada and say that there are challenges. You can't flick a switch and just make all those challenges disappear. It comes with working with the NLMA and an organization like the NLMA to resolve these issues. But I believe that what we've accomplished over the last 12 or 14 months in working with the NLMA has been very significant progress, and that work continues. We're currently in discussion with the NLMA now, and the NLMA can't unilaterally make changes. The health authority or government cannot unilaterally make changes. These are issues that are worked on jointly between government and the NLMA. to resolve the issues. And we're currently or started talks now on the next MOU. Chris, did you want to add to that?
Again, to be clear, I'm not the spokesperson for the NLMA today. That would be Dr. Gerard Farrell. But I guess from the perspective of Killick Health Services and what's going on in Grand Falls-Windsor, this community has really been hit hard by the human resource shortage. Being rural and remote and having all these remote emergency departments has really put a strain on the local care providers. And I agree with the minister. This is being recognized and investment is occurring, and this is part of some of the changes that are necessary. And I think we all wish it could happen faster, but I do see this as progress. And in particular, with this initiative, what we're hearing from physicians on the ground is just overwhelming work burden. So now there's teams. There'll be a team in this community to start to support some of that care burden. So I think that things are being done, and one hopes that this is going to be a key component of helping physicians to be able to be re-engaged back into family medicine practice in a much more supported way.
Yeah, and if I could add to that, I guess some breaking news today. But before I get to that, that's the teaser. We are working with the NLMA now on administrative burden. That's one of the discussions that we are talking about. We do recognize there are challenges. As I said, there are challenges in every province, but the NLMA have been a solid partner in working on and resolving the issues that physicians in this province face, and we work together to resolve those issues. But for Grand Falls-Windsor, we have added Grand Falls-Windsor, and I'll make that announcement now. I think we were looking at making that announcement a little bit later this week, but we've added that to one of the areas that is hard to fill, as we are adding Deer Lake. So for physicians signing a contract, family physicians in Grand Falls-Windsor or in Deer Lake, the amount will be $200,000 incentive to those individuals, and that is to address some of the human resource challenges that Grand Falls-Windsor is facing. The $200,000 that was in place in Labrador, we're increasing it to $300,000 in recognition that that they have more significant challenges and different issues to deal with. So happy to make that announcement today and talk about that, because Grand Falls-Windsor has faced significant human resource challenges. So this is meant to get at the heart of those challenges.
Dr. Luscombe, I just want to ask you about those bonuses. Is the issue with getting people a financial one? Does $100,000, $200,000, $300,000 make a difference and address some of the concerns that doctors have?
So obviously I can't speak for each individual physician. What I have heard in my many roles is it's a combination between competitive and fair compensation and a good work environment. So undoubtedly, these financial incentives are good carrots to help draw people into the system. But we've continued to say, and I think government has continued to recognize, that the system has to function better. There's no amount of money that's going to make somebody, work to a point of being burned out and overwhelmed. So I think that the solutions are complex, and I'm really happy to see that we're looking at taking multiple approaches to both handle the fiscal realities and the compensation side, but also to make this job sustainable and healthy and attractive so that young people will now choose careers in medicine.
Do you have any idea how many physicians are operating in Grand Falls right now?
We can get you that number, but I did want to add to what Dr. Luscombe has said, and I know under the last MOU there was approximately a 13% increase for family physicians in the province. We all know that due to COVID and other pressures, inflationary factors, that much of that increase has been eaten away because of inflationary factors. So the next round of discussions with the NLMA and Dr. Farrell, I am looking forward to that. We recognize the challenges and the pressures that family physicians face in the province, but that has to be resolved through mutual discussion and negotiation and an MOU. And we are certainly looking forward to working with Dr. Farrell and the NLMA. I believe we have a very positive relationship, and I look forward to continuing that positive relationship as we both work to resolve some of the, because as Peter said, I mean, the financial aspect is part of that. We can put an incentive in place. The other issues, we'll work with the NLMA on resolving the outstanding issues.
Question for you about the urgent care clinic that was set to open in St. John's early next year. I understand from the health authority there was an RFP. They've canceled it because it came in over budget. What does that do to the plans to create this new clinic to take strain off the emergency room?
So the plans have not changed. We will continue to focus on the timelines to establish the urgent care clinic. The RFP was considerably higher than the budget allotted for the urgent care. So I know that the Provincial Health Authority has gone back to the drawing board. They will be reissuing a tender for urgent care in the province, but we are still dedicated to the timelines in establishing that urgent care.
So even if a tender is going out now, you still think spring 2024 is realistic for being able to have one up and running?
We certainly hope so. Yep, that is the aim. It'll certainly be established in 2024, and the aim is to maintain the timelines that we've set out to establish the urgent care.
You mentioned they're making changes. What sort of changes are they making in order to bring that cost down?
I think we have to wait and, based on the RFP process, that's something that I don't get involved in, nor should I be involved in the RFP process. But I believe they're looking at, where they may, where changes need to be made in terms of the RFP to ensure that we establish a successful proponent and move on with the urgent care centre. All right. Well, thank you very much, and thank you, Dr. Luscombe.
Thank you.
Thank you, everyone. Have a good day.